Skinstructors tip of the week. Let's talk about sunscreen application and the two-finger roll. We all know sunscreen is crucial for protecting our skin from harmful UV rays and preventing premature aging and, most importantly, skin cancer. But are you applying enough? A common mistake is using too little product, which significantly reduces the SPF's effectiveness. So here's a simple two-finger roll. For your face and neck, squeeze a line of sunscreen along the length of your index finger and another line along the length of your middle finger. That's generally the right amount to adequately cover this area. For other parts of your body, adjust accordingly. Think about a shot glass worth for the entire body. Using this two-finger roll helps ensure you're applying a sufficient layer of sunscreen to achieve the stated SPF on the product. Make it a habit, just like brushing your teeth. Consistent and generous application is key to getting the full protective benefits.
Welcome back to the Skin Instructors, the podcast where we bring you all things aesthetics. I'm your host, Morgan.
And I'm Jolie. Today, Morgan and I are tackling a really important topic for everyone in the aesthetics world and, of course, for our clients, understanding skin cancer.
Absolutely, Jolie. While our focus is often on enhancing skin health and beauty, being knowledgeable about potential risks like skin cancer is a fundamental part of responsible aesthetic practice.
Exactly, Morgan. And I think sometimes the sheer prevalence of skin cancer can be underestimated. It's the most common form of cancer in the US, and what's sobering to remember is that approximately 1 in 5 Americans will develop skin cancer in their lifetime.
That statistic really underscores the importance of this discussion. And to lay the groundwork, it's helpful to understand the basic structure of the skin. As we know, the outermost layer is the epidermis, which is made up of 3 main types of cells: squamous cells, basal cells, and melanocytes.
And these are the very cell types where the primary forms of skin cancer originate. The two most common are basal cell carcinoma, or BCC, which starts in the basal cells, and squamous cell carcinoma, SCC, arising from squamous cells.
And the numbers are quite significant, Julie. It's estimated that millions of Americans are diagnosed with these types each year.
Yeah, that's right. We're looking at around 3.3 million Americans diagnosed annually with basal and squamous cell skin cancers. However, because some individuals develop more than one, the total number of diagnoses is actually closer to 5.4 million each year.
That really puts the prevalence into perspective. Let's talk a little bit more about each of these common types. Jolie, what are some key things we need to know about basal cell carcinoma?
Well, BCC is the most frequently diagnosed skin cancer. It develops in the basal layer of the skin, and while it can occur in anyone, it's more common in those with fairer skin. A significant risk factor is prolonged exposure to UV radiation from both the sun and, importantly, from indoor tanning.
And it's so important for us to educate our clients that tanning beds are not a safe alternative. What are some of the potential consequences if BCC goes untreated?
Early detection is key. While BCC tends to grow slowly, if left unaddressed, it can invade deeper tissues, potentially damaging nerves and bone, which can lead to disfigurement.
So what are some visual cues or changes we might observe on a client's skin that could be indicative of BCC?
It can present in a few different ways, Morgan. It might look like a pearly or waxy bump, sometimes with visible small blood vessels. Other times it could appear as a flat, flesh-colored, brownish scar-like patch, or even a sore that doesn't heal properly. Now let's move on to squamous cell carcinoma. How does it differ from BCC?
Squamous cell carcinoma is the second most common type, Jolie, and as the name suggests, it originates in the squamous cells of the epidermis. Like BCC, it's more prevalent in individuals with fair skin, but can affect all skin types. It often develops in areas that receive a lot of sun exposure, such as the ears, face, neck, arms, chest, and back.
These are certainly areas that we focus on in our aesthetic treatments, making our awareness even more important. What might SCC look like on the skin?
SCC can be quite variable in appearance, Jolie. It might present as a firm red nodule, a scaly, crusty patch, or even a sore that heals and then reopens. Any persistent or unusual skin changes in these sun-exposed areas should definitely warrant a referral to a dermatologist.
Absolutely. And it's crucial to emphasize here that as estheticians, we cannot diagnose skin conditions, including skin cancer. Our role is to be observant and knowledgeable so we can recognize potential concerns and strongly encourage our clients to seek examination by a board certified dermatologist.
That's a vital distinction, Jolie. Our expertise lies in skin health and aesthetics, and recognizing when a client needs medical evaluation is a key part of responsible practice. And we also need to discuss melanoma, which, as we know, is often considered the most serious form of skin cancer.
Yeah, that's right, Morgan. Melanoma, which begins in the melanocytes, has a greater tendency to spread to other parts of the body, making early detection and treatment absolutely crucial.
And it's important to remember that melanoma can develop from an existing mole or appear suddenly as a new dark spot that looks different from other moles. This is why regular skin self-exams are so important. When we see something concerning, referrals to dermatologists are so vital.
Yeah, and this brings us to the ABCDE warning signs for melanoma, which are important for both of us and our clients to be familiar with, right, Morgan?
Exactly, Jolie. The ABCDEs are a great way to remember the key characteristics to watch for. A is going to stand for asymmetry. One half of the mole doesn't match the other. B is for border. The edges are irregular, notched, or blurred. C is for color. The mole has uneven colors, such as shades of black, brown, tan, red, white, or blue. D is for diameter. The mole is usually larger than 6 millimeters, although melanomas can sometimes be smaller. And lastly, E is for evolving. The mole is changing in size, shape, color, or elevation, or if new symptoms like bleeding, itching, or crusting appear.
Those are critical points for early detection. Now, shifting our focus to prevention, which is a cornerstone of our work in aesthetics, what are the primary ways we can advise our clients to minimize their risk of skin cancer?
Prevention is key, Julie, and it largely comes down to a multifaceted approach. The foundation is, of course, protecting the skin from excessive ultraviolet or UV radiation. Overexposure from sunlight and tanning beds is the leading cause of skin cancer, as this cumulative damage can lead to DNA mutations in skin cells.
So, the number one recommendation we should be making is consistent and proper sunscreen use, right? And there are different types of sunscreen to consider.
Absolutely, Jolie. So SPF, or sun protection factor, indicates the level of protection against UVB rays. For example, an SPF of 30 means it would take 30 times longer for your skin to burn compared to not wearing sunscreen. We also need to educate clients about the difference between chemical and physical sunscreens.
Right. Chemical sunscreens absorb into the skin and then absorb the UV rays, while physical or mineral sunscreens containing ingredients like zinc oxide and titanium dioxide sit on the surface of the skin and block the UV rays.
Exactly. Both types can be effective, and the best choice often comes down to personal preference and skin sensitivity. However, the most important thing is to choose a broad spectrum sunscreen with an SPF of 30 or higher and apply it generously and consistently.
Yeah. And beyond sunscreen, Morgan, what other preventative measures should we be discussing with our clients?
In addition to diligent sunscreen use, incorporating topical antioxidants into a skincare routine can offer another layer of defense against skin cancer.
Yeah, that's a great point. Can you explain how antioxidants can help in prevention?
Yeah, of course. So UV radiation not only directly damages the DNA, but also generates free radicals within the skin. These unstable molecules can cause further cellular damage and contribute to the development of skin cancer over time. Topical antioxidants such as vitamin C, vitamin E, niacinamide, and ferulic acid help to neutralize these free radicals, essentially acting like scavengers to protect skin cells from this indirect damage.
So, by reducing free radical damage, antioxidants can help to prevent some of the cellular mutations that can lead to cancer.
Exactly, Jolie. While they aren't a substitute for sunscreen, topical antioxidants work synergistically with sun protection to provide more comprehensive defense against UV induced damage. Think of it as an internal defense system working alongside the external barrier of sunscreen.
That's a really important addition to our prevention discussion. So, in addition to sunscreen, we should also recommend incorporating antioxidant serums and creams into our clients' daily routines.
Absolutely. On that note, some of my clients have refused to wear sunscreen because they believe the chemicals in it can cause cancer. Julie, can we discuss some verbiage that other estheticians can use to address this concern?
Yeah, absolutely. So, if a client says that they don't use sunscreen because they've heard it causes cancer, this is some verbiage that I've used. I understand your concern. There have been some discussions and even misinformation circulating about sunscreen ingredients. However, the overwhelming scientific consensus from organizations like American Academy of Dermatology and the Skin Cancer Foundation is that sunscreen is a critical tool in preventing skin cancer. The risk of developing skin cancer from the sun exposure far outweighs any potential risks associated with sunscreen use. Modern sunscreens undergo rigorous testing to ensure their safety and effectiveness. Perhaps we can discuss the different types of sunscreens and find one that you feel comfortable using. It's important to be empathetic, acknowledge their concern, and then gently guide them towards accurate information supported by reputable sources.
Yeah, that's great advice, Jolie. It's about addressing their fears with factual information and offering solutions. And of course, we continue to emphasize wearing protective clothing like wide brimmed hats and sunglasses and seeking shade during peak sun hours as essential preventative measures.
Exactly. I have a lot of clients, including my mother, who are sun worshipers. I'm fine with them enjoying the sun as long as they are taking these protective measures. Morgan, now that we've touched on the misconception that sunscreen causes cancer, what about the myth that people with darker skin tones don't need to wear sunscreen?
That's another really critical myth we need to address head on, Jolie. It's absolutely false that skin of color is immune to sun damage or skin cancer. While it's true that melanin provides some natural protection, it's not enough to completely negate the risks of UV exposure. People with darker skin tones can and do get skin cancer, and often it's diagnosed at a later, more advanced stage, which can make treatment more challenging.
Yeah, that's a really good point. So, how can we best educate our clients with skin of color about the importance of sunscreen?
We need to emphasize that while they may not burn as easily, they are still susceptible to UV damage that can lead to skin cancer, including melanoma. We can explain that sunscreen isn't about preventing sunburn, it's about protecting skin cells from DNA damage that accumulates over time. We can also highlight the hyperpigmentation and premature aging, which are common concerns for many clients with skin of color, are also exacerbated by sun exposure and can be prevented with consistent sunscreen use. Finding lightweight, non-greasy formulas that don't leave a white cast is key to encouraging compliance.
That's excellent guidance, Morgan. It's about dispelling the myth with clear factual information and addressing specific concerns relevant to their skin.
Absolutely, Jolie. And importantly, if we ever observe anything concerning on a client's skin, our professional responsibility is to recommend they consult a board-certified dermatologist for examination and diagnosis.
Precisely, Morgan. It's about prioritizing our clients' health and well being above all else and ensuring everyone understands their risk and how to protect themselves. This has been an incredibly important and informative discussion. It's vital for us as estheticians to be well versed in all aspects of skin health, including skin cancer prevention, addressing misconceptions, and the importance of dermatologist referrals to best serve and educate all of our clients.
Agreed, Jolie. It's a conversation that needs to be ongoing and reinforced with every client interaction. Well, I think that's it for today's episode.
Thanks for tuning in to the Skin Instructors podcast. We'll see you next time. Don't forget to rate, subscribe, and review. And as always, don't hesitate to educate.